Hello, everyone. Welcome to our webinar where we will be reviewing a 2020 update on office-based anesthesia led by Dr. Fred Shapiro and Dr. Richard Urman. I am Rosalind Ritchie, Medical Director at the Center for Advanced Surgery at the University of Kentucky, and I am Chair of the Office-Based Anesthesia Committee for SAMBA. I will moderate this webinar. For those of you who are not SAMBA members, please consider joining the society as it offers many benefits to the members. Please visit our website at www.sambahq.org to see the benefits of membership. Now, for a quick housekeeping note before we get to today's presentation. In the upper right side of your computer screen, you will see a control panel. Please note that this webinar is listen-only mode. Submit your question in the chat box. You can type in a question or even comment and submit it at any time during the presentation. We will have time for questions and answers at the end of the presentation. Now let me introduce our great speakers today, Dr. Fred Shapiro and Dr. Richard Urman. Dr. Fred Shapiro is an associate professor of anesthesia at Harvard Medical School, Beth Israel Deaconess Medical Center Department of Anesthesia, Critical Care, and Pain Medicine in Boston, Mass. Dr. Shapiro serves on the SAMBA Education as well as the Office-Based Anesthesia Committees and is an advisor to the Residence Committee. It is important to note that Dr. Fred Shapiro is also the immediate past chair of the ASA Committee on Patient Safety and Education. Our second presenter today is Dr. Richard Urman. He is an associate professor of anesthesia at Harvard Medical School, Brigham and Women's Hospital, and the director of the Center for Perioperative Research. Dr. Urman also serves as the chair of the SAMBA Communications Committee, the ASA Abstract Subcommittee on Patient Safety and Practice Management. Now for our presentation. Dr. Shapiro, you may begin.
Thank you, Rosalind.
Welcome.
I have nothing to disclose. Just to let you know that Rich and I founded a nonprofit patient safety organization, the Institute for Safety in Office-Based Surgery, and the purpose was to promote patient safety and outcome research, design tools for advanced detection and prevention of adverse events, collaboration between all subspecialties, educate physicians and patients, ultimately generating an evidence-based standard of safer office care. The learning objectives for this evening's webinar are, first, to identify the most common safety-related issues encountered in the office-based surgical and anesthesia setting, understand the key safety considerations when setting up a safe office-based surgical practice, understand the safety issues regarding appropriate patient and procedure selection, and a little bit about practice management, facility accreditation, checklists, and emergency preparedness. Specifically, my section of the webinar will review the office-based anesthesia and surgery, some of the safety literature, talk about accreditation, challenges and updates in 2018 and 19, hot topics in practice management, and an update in state regulation. And below are two of our most recent publications where the talk comes from. Recently, all of these people have in common that they died undergoing an office-based anesthesia and surgical procedure. A teen of malignant hyperthermia, an 8-year-old in a dental's office, a 25-year-old having extraction of wisdom teeth, a 3-year-old, and everyone also knows about Joan Rivers. In 2011, this came from the USA Today, and it looks at 2 women who died after having liposuction. Unfortunately, their doctor was not board certified, took a weekend course in cosmetic surgery, and there was no law to stop him. This was in 2011. This same occurrence happened in Florida in May of 2019. these events continue to occur. Another article in USA Today, what the public read, was about these surgeries leading to tragic results. A comment from Bill Prentice from the Ambulatory Surgery Center Association, and he said that we shouldn't have a patchwork system. One state asks for one thing, others for other. What we need is consistency. So we did a little research on this. And in fact, if you look at this chart, we do have a patchwork. This is from the ASA. We currently have 33 states have legislation. The reporting of adverse events varies from state to state. And 17 states actually have no mandatory adverse event reporting. Therefore, outcome data